One of the problems with Hirschsprung disease is it can be a pretty dramatic, life-threatening presentation where they come in with this horrible illness called Hirschsprung-associated enterocolitis. The bellies are big and distended, and they're vomiting, and they have diarrhea, and they're really on death's door. And if you don't make the diagnosis, it has the potential to go the wrong way. And we would operate on these children, they would get better, but then they'd come back after surgery with the same problem happening over and over and over again, as if we hadn't done the right operation for them. And so it got me thinking that for this disease process, there must be some kind of interaction like that happens in the skin happening in the gut, because we have this brain of the gut, the enteric nerve system, and maybe that enteric nerve system is talking with the gut mucosal immune system and influencing how it functions, and that's part of what's making these children susceptible to this life-threatening presentation. And I decided I was going to tackle that because it was a problem that was really frustrating to me as a surgeon. I saw how frustrating it was to the patients and families, and I decided I was going to figure that out. Getting the Clowes Award was a truly memorable time in my career. I think anytime you receive an award from the American College of Surgeons, it is a major kind of stamp of approval and affirmation that the work that you're doing is really important, right? That it impacts our patients or our profession. And at that point in my career, I received notification, I think in spring of 2015, and I was a faculty member at the University of Wisconsin. I had just been recruited to University of Tennessee and was leaving that summer. But it was just like a nice boost of confidence that the work that I had been kind of pursuing was important. And it came at a time where my startup funds that I had from starting on faculty were starting to dwindle, and really provided that extra support that was necessary to keep a lot of that work going.